And I can also text him to make sure. And then I think we are officially in the live session. So we're just going to go ahead and give it a few more minutes to see if our moderator can join us. If not, then we'll go ahead and get started.
Sounds good.
Hi, everyone.
Oh, perfect. All right. Hi, Raj.
Yeah, I just got carried away with all the questions and I started answering. I've been nonstop answering all those texts and I'm just like, oh shoot, I haven't. But it was, it was great. We had, I think at peak we had 200 plus people in that.
Oh, wow.
Are
That's
we
amazing.
live already
Yes,
presenting?
we are
Okay.
live. So if you want to go ahead and introduce Kara.
Yeah, just give me one quick second, and
Of
then
course.
how are you, Kara?
I'm doing great.
Yeah, thank you so much
Of
for
course.
doing this. Again, you and I'm sure people are moving in, so we can use a couple minutes of small talk as well. Um, really, I mean, I'm just saying I don't have words to really define my gratitude for you to coming in and doing this. And this is such a huge topic as well. So as people are coming in, I will just go ahead and introduce you. And as I said, the previous session for the same track, we had really, as we call it in live session, standing room only, and such a robust discussion. And this will be exactly the same thing. So, welcome everybody. I'm Raj Mahajan, and yes, it's been a great day for us, and having all these esteemed speakers with us. And I have Dr. Kara Jacobs, Slifka, with me, who really is the nursing home person at CDC right now throughout the pandemic. We have just been blessed to have you and your expertise all along to tell us about different things that are out there around, and then now with vaccines. So thank you for coming, everybody. Kara, Dr. Jacobs, is an infectious disease physician and medical epidemiologist in the prevention and response branch within CDC's division of healthcare quality promotion. In her role at CDC, she leads the long-term care focus on improving infection prevention and containing and preventing the spread of infectious pathogens in the post-acute long-term care setting. And this is done through collaboration with health departments and partners, guidance and educational material development, and outbreak response. And I love how CDC folks have really been very, very short with their biography. I've seen your work. I've seen your resume. It's definitely pages and pages long. So, if you want to just tell us a little bit about yourself, and other than what I just read off, so that'll be very helpful. And the stage is all yours, Kara.
Sure. Thank you so much. I thought I would just quickly come on camera to say hi, and I'll disappear again before I start talking, just so we don't run into any technical issues. But hi, I'm Kara. I'm happy to be here today to be able to talk with you a little bit about the changing epidemiology of COVID-19 in the long-term care settings, really focused on nursing homes, and then also talk a little bit about continuing to promote vaccination. But yes, I'm an infectious disease physician. Most of my training actually happened up closer to you all in Michigan. And then quite a few years ago now, came down to Atlanta to do some additional training through the Epidemic Intelligence Service at CDC, and also my infectious diseases fellowship. So I've been back at CDC for a little while now, and working specifically in the Division of Healthcare Quality Promotion, focused on healthcare settings. But within our group, as Raj was saying, focused on the containment and prevention of infectious pathogens, of the spread of infectious pathogens, really focused in the long-term care setting. So with that, I will go ahead and get started. Okay, so let me just... All right, make sure that the slides are actually, okay, perfect. It looks like on my end the slides are updating for you all, but please someone let me know if there are any issues with the connection or with the slides.
Yeah, the transition happened just fine.
Perfect.
We're good.
Okay, wonderful. All right, so before I go any further, I will just say that I don't have any disclosures to report, but do need to share that the content of the presentation is my opinion and does not necessarily reflect the official position of CDC. And then also, before I go any further, I want to make sure that I first and foremost say thank you to all of you. Thank you for your support and your work throughout this pandemic. It has been a very long and difficult road, and I think that we are all beyond ready to for this pandemic to be over, to move on, to resume as much normalcy as possible. But we aren't quite there yet. And so I want to make sure that you all know that we recognize your hard work and that you are very much appreciated. So I want to start by reviewing a little bit about the pandemic. This timeline here represents some of the measures that have been taken by CMS in collaboration with the CDC. So going back, I very clearly remember a notification that came in on Friday, February 28th of last year regarding the first COVID-19 outbreak at a skilled nursing facility. We at CDC rapidly deployed a team, but were really quickly made aware of numerous other nursing home outbreaks that were occurring around the country, where the initial introductions seemed to be observed to be related to either positive staff member, a positive visitor, or even a resident who had left the facility and had come back in and were thought to bring that infection back with them. So nursing home restrictions on visitation were introduced. And CDC worked very closely with CMS to help update their infection control survey pathway to specifically focus on some of the important COVID-19 specific infection prevention practices, such that as much as possible, we in public health, at the federal government level, but also state and local levels, could get out and reach as many facilities as possible, and try to work on preparing for COVID-19 and also trying to respond to outbreaks that were already happening. In April, the National Healthcare Safety Network, or NHSN, reporting for nursing homes broadened to include COVID-19 reporting of infections as well as supplies and resources, given that at that time severe supply shortages were what we were seeing. And eventually that reporting did become mandatory. Testing resources had also been quite scarce at the beginning of this pandemic. Testing wasn't able to be performed widely despite evidence of asymptomatic infection. And so in July of 2020, point of care antigen testing machines were distributed to all nursing homes. And reporting of point of care antigen testing would eventually become required a few months later. Guidance continued to be updated over this time as we learned more about the virus, as we learned about transmission, as we better understood outbreaks and why we were seeing larger outbreaks or outbreaks in certain places, and those continue to be updated. And by about August of 2020, specific testing requirements for outbreaks and for staff screening were put into place. As our understanding continued to evolve, changes to guidance, including visitation, continued to occur. And then around October, with vaccine approval and recommendations anticipated, the Federal Pharmacy Partnership Program planning began. And then those vaccine clinics began in late December. Most nursing homes had a series of 3 vaccine clinics, and were able to fully vaccinate around 70% or so, or more of their residents by around February to March. And with most residents vaccinated, CDC was able to begin a stepwise process of starting to loosen the restrictive guidance in nursing homes and other long-term care settings around April. More recently, by June, COVID vaccine reporting has become mandatory, allowing us to better assess where vaccination coverage rates are among both residents and staff of nursing facilities. So, COVID-19 has made an extremely significant impact on nursing homes in the United States. As of this month, there have been over 650,000 nursing home resident confirmed cases. So in trying to put this number into context, and thinking about you all, I was looking up some census data on Illinois and Chicago. And, as you, I think, are probably even better aware than I am, Chicago being one of the largest cities in the US, looking at that total number of confirmed COVID-19 cases in residents is more than twice the number of older adults that I found listed in the city of Chicago, despite the large population. So this is a very significant number, and more than 130,000 deaths. And while nursing home staff tend to be lower risk for severe illness and serious outcome, we have still seen over 580,000 infections and close to 2,000 deaths. And reports have shown an increased infection burden among long-term care staff compared to other healthcare settings. Now, I know these figures are maybe a little bit small, and they don't yet include July data, but what I wanted you to be able to see here is how significant infection rates have changed over time in both staff, in that purple or blue on the left side, and in residents, in the orange or tan color on the right during this pandemic. You can see that both staff and residents follow similar curves for the most part, meaning that when we saw outbreaks occurring in nursing homes and infection rates were going up, they went up for both staff and residents and then tended to come down at the same time. That largest peak occurred from the October into the January time period, but you can see that by the time vaccine clinics started in nursing homes, which I've tried to indicate here with the blue arrows, infection rates were at least stable, if not already decreasing at that point. So there is no doubt that vaccination has made a huge impact on COVID-19 in nursing homes, and that impact has persisted. But rates were already starting to change a bit prior to vaccination. Probably multifactorial, possibly related to natural immunity from recent infections, to the infection prevention work that was being done, the testing in place, rapid response to newly identified positive individuals, a lot of different reasons. And I'm going to share a little bit more over the next couple of slides, but we have seen increased vaccination uptake in residents compared to staff. So it's interesting to note that a couple of months ago, around the April time period, we saw a little bit more of an increase in staff infection rates without really seeing much of an increase in resident rates. But we do continue in general to see decreases overall at the national level in both residents and staff infection rates. So a few months ago, an MMWR came out reporting some very early estimates of nursing home vaccination coverage with 1 or more doses. So this is going back to January of this year, already 6-7 months ago. And this information was coming directly from the Federal Pharmacy Partnership Program and included data from around 11,000 nursing homes. And even early on with a single dose uptake, we saw a really great acceptance among residents, with the median estimate for a single dose of vaccine uptake around 78% of residents. The numbers look a little bit different in staff, and at that point was about 37.5% in staff. But fast forward a couple of months to around April, by the completion of the Federal Pharmacy Partnership clinics in nursing homes, more than 7.8 million doses were given in long-term care facilities. Data it's a little bit challenging because the Federal Pharmacy Partnership data is a little bit higher level. And even though nursing homes at this point were able to report COVID-19 vaccination, early on this was voluntary and only a limited number of facilities were choosing to do so. However, since the CMS reporting requirements for vaccination went into effect, we are now getting reports coming in from around 14,800 over that, really, nursing homes. And so with that more recent information, among those 14,800 nursing homes reporting, any COVID-19 vaccination has been reported in almost 83% of residents, with completed vaccination being at about 80%. And about 61% of staff have been reported to have had any COVID-19 vaccination, with complete vaccination at around 58-59%. You can see, though, that when you look at the distribution in residents here on the top in blue compared to staff at the bottom in green, it's a little bit different, with residents skewed towards having higher receipt of any vaccine compared to staff, where the distribution is a bit wider. And CDC does have a nursing home COVID-19 vaccine dashboard where you can go and review updated data on coverage among staff and in residents in nursing homes by state and nationwide. And it's an interactive tool, so if you hover over a state, like on here, I have it hovered over Georgia, you can get some specific information for that state. So, as you may be familiar, the FDA had issued an emergency use authorization, or EUA, for 3 different vaccines after clinical trial data from testing of thousands of adults and now children have shown that these vaccines are effective and that they are safe and that they can help prevent SARS-CoV-2 infection. All of this information, there is large amounts of information that are available geared towards either healthcare personnel or towards patients and residents and family that are available on the CDC website. And this includes information about how the vaccines trigger an immune response to that SARS-CoV-2 spike protein, and a description of, at least a general description of, how the vaccines work. And so, as a quick reminder, the mRNA vaccines essentially are teaching our cells how to display that spike protein so that the body's immune system can identify and respond. And those viral vector vaccines use a slightly different mechanism, but again, instruct those cells to display a piece of spike protein for the body's immune system to respond to. And neither of these vaccines contain live virus. CDC has also tried to create some fact sheets, some information about the vaccine to combat some of the more common myths that we have heard about. I'm sure that many have heard, some of the different questions, some of the different misconceptions, including things like that the vaccine cannot give you COVID or cause you to test positive, that the vaccine can prevent you from getting sick and from developing severe illness. And even if you have already had COVID-19, that you may still benefit from that additional protection that the vaccine can offer. I'm sure that there are many others that you all have heard about, or that we have seen passed around via social media or even just conversation. So I also want to talk a little bit about vaccine safety, because this is absolutely essential, and a lot of questions come up specifically related to safety. COVID-19 vaccines are held to the same safety standards as all vaccines. And this includes a careful review of safety data by the FDA and by the ACIP, or the Advisory Committee on Immunization Practices, a group of experts who review that safety data and use that to make recommendations on vaccine use. And then monitoring continues to occur, monitoring for safety after those vaccines have been authorized, by looking for side effects from the FDA and from CDC. And this monitoring of vaccine safety is not a new thing. There are existing systems that have been in place for many years. For example, VAERS. These are passive reporting systems in which anyone, patients themselves, parents, healthcare personnel, can go in and enter information about any kind of adverse event that may have happened after receiving a vaccine, any vaccine. During the pandemic, however, with the authorization of the COVID-19 vaccines, this new system called vSafe was developed to allow for more active surveillance. And some of you may have participated in this, but it will send you text messages and ask you how you're feeling, if you have a fever, and even remind you about your second dose, for example. But this allows recipients to enter information and to follow up on and kind of shine a light on any kind of clinically important events so that they can then be immediately followed up on. And you can access information about these monitoring systems online in case you have interest in reading more or you have questions. You can refer folks to these sites where there is an explanation. And then after receiving your vaccine, you can get the link or code to be able to specifically register with vSafe. So as soon as we started vaccinating nursing home residents, we continued to try to actively learn as much as we could about the vaccine and about effectiveness for this specific population of older adults. And one of the ways that we did this very early on was looking for outbreaks that were occurring after the time nursing homes started having their vaccination clinics. So, for example, we deployed a team in February to visit 2 Connecticut nursing homes that were having outbreaks between their first and third vaccination clinics. And ultimately, what we were able to do was gather information and estimate the vaccine effectiveness of that vaccine for residents who were partially vaccinated. Because at this point, there weren't residents had not been completely vaccinated, although there were some who had received their second dose. Many had their first, but at least we wanted to see how or if that vaccine was protective in an outbreak situation. And we found that even having received at least 1 dose of a 2-dose vaccine was 63% effective at preventing new SARS-CoV-2 infection. We recognize that about a quarter of them, 25%, had a previous history of SARS-CoV-2 and wondered if that may have offered some protection. But when we performed additional sensitivity analyses, we found that the vaccine effectiveness was essentially the same. Additional data looking at vaccine effectiveness among healthcare personnel, specifically in first responders, was published earlier this year, based on data gathered during those first few months of vaccination. And with close to 4,000 participants, demonstrated that a vaccine effectiveness of 90% at preventing SARS-CoV-2 in fully vaccinated individuals. And further vaccine effectiveness data against COVID-19 hospitalization among older adults who were over the age of 65 years, not specifically long-term care, adults coming from long-term care settings, but this again demonstrated that the vaccine was extremely effective at 94% at preventing COVID-19 hospitalizations among fully vaccinated individuals. And even when they looked only at partial vaccination, was still highly effective at 64%. So I know I've just run through a couple of these studies, this supporting data, but I think it's important to start to see how at least some of the early examples of how many have been trying to understand and summarize what we are seeing real world with the use of these vaccines. And there is more data that is continuing to be collected and continuing to be released to help monitor where vaccine effectiveness is. Now, I do also want to take the opportunity to say that it is this data, and it is the NHSN data that is coming in, and it is the outbreak experiences and what we are learning from all of you and from work with health departments, and the changing epidemiology of the pandemic that we are seeing that directly influences the guidance that both CDC and CMS create for nursing homes. And you can access both of these online. And I will also share that likely in the next few weeks, there will be continued updates, again, as we continue to learn more. So now I want to spend a little bit more time talking about Vaccinate with Confidence, a national strategy to reinforce confidence in COVID-19 vaccines that really involves building trust through sharing accurate messages, empowering healthcare personnel through promoting confidence, and engaging communities and individuals in an inclusive way using two-way communication. An essential piece of vaccine confidence and increasing vaccine uptake is building that trust. When you have trust and you have created this relationship, you are more able to effectively deliver messages. And I think this goes beyond vaccines to a lot of different areas of healthcare and other completely different messaging as well. But the goal is trying to be able to share credible information, but also being able to address misinformation. And that two-way dialogue is important to be able to not only share, but also listen and address questions and concerns. And it's okay to not always know the answers or have the answers, but being able to get to the point of even asking and hearing and letting others share those concerns with you is a hugely important step. And there are resources that we are actively trying to continue to develop to help you find answers to those challenging questions. Now, as the slide states, it will take more than one conversation to change minds, especially when there is lack of trust that contributes to vaccine hesitance. Building that trust can definitely take time. I will share that when we have spoken with individuals who have made the decision to take the vaccine or even changed their mind, ultimately were skeptical or had decided against it and did make that switch, they decided to take the vaccine. Some of the things that they have shared with us were citing, they cited trusted peers as a resource, both within their workplace, within their facility specifically, but also in their community. They have cited not just their peers, but also leadership at their workplace. And that could be administrative leadership, that could be clinical leadership as well. So some of the strategies for building COVID-19 vaccine confidence among healthcare personnel, including things like encouraging senior leaders to be vaccine champions and to help lead those discussions, hosting discussions with different groups of staff where staff are able to share their input, or trying to create a safe space where they can share their input but also ask questions. Sharing key messages. This may differ depending on the group we're talking about, but this could be emails or posters or videos. During some focus group calls that we have had with frontline nursing home staff, with CNAs or nurse aides and EVS staff, they actually commonly shared that they get their information about COVID-19, about the pandemic, directly from their workplace, from the facility they work at. But many of them actually mentioned that they also really like to have emails that they could read in their own time. And I will also just put a plug out there, don't forget about non-medical staff as well. And CDC encourages you to make that decision yourself to get vaccinated, and when you do, to share it and to celebrate it. Some additional strategies are listed here for long-term care facilities, and they include empowering vaccine acceptors as advocates. So beyond just having leadership as vaccine champions, looking at your staff and identifying those that may be trusted peers to talk with, encourage, and motivate their coworkers. Removing any kind of barriers to vaccination as much as possible, and making access to the vaccine as easy as possible. Celebrating successes and encouraging people, if they're willing and interested, to share their personal stories. CDC definitely has a wealth of information. It's sometimes a cumbersome website, and even myself, having looked at it many, many times, can sometimes become frustrated with not finding what I want to find. But there really is a wealth of information and links to additional resources on the website. You can find more information at the URL here on this slide. But stopping this pandemic is really going to take all of our tools, and building vaccine confidence continues to be a critical strategy to increase uptake, but it really does require a team effort and require continued effort. And as I mentioned earlier, all of our guidance and implementation materials for preventing COVID-19 in nursing homes and in other long-term care facilities have really been informed by the experiences of providers in the field. So we continue to review and update these documents as we continue learning with and from our provider community and our academic partners. And so with that, I just want to say thank you. Thank you again, because I have learned so much from working with many of you. And I appreciate being able to have the opportunity to share a little bit about what we have seen so far throughout this pandemic, and a little bit about where we still have work to do. So with that, I will stop. I'm happy to take questions. I would also love to hear from any of you about successes or challenges that you have seen specifically related to vaccination in your settings.
Absolutely. Thank you, Dr. Jacobs. I mean, that really was a very nice overview, and some of the data, especially the updated one, was just I mean, not only a punch to the gut. And I know Deb Bursell has used some adjectives in her comments too, but definitely, it was very informational. We do have a question/comment. I'm going to read that for you, and please tell us if you can or cannot comment on that. And then I, as a practicing clinician, would probably speak to that as well. So the question is: recent reports in the media regarding fully vaccinated persons becoming infected with COVID-19 are creating a bigger challenge in talking to vaccine resistors about the effectiveness and need of vaccination. What is the CDC doing to respond? And that question is from Anna Johnson, an administrator at a nursing facility.
Yeah, this is actually, this is a very, very timely question. Actually, earlier today was just on a call with, it was on a call with some of the Quinn QIOs and as well as our colleagues at CDC who are really focused on some of the vaccination efforts, including our efforts to increase vaccine confidence, but also our efforts to understand vaccine effectiveness going forward, really across the board, but we kind of loop them in because they're also interested in long-term care setting as well. And so this question was essentially what this conversation was about earlier today, because the observation or the feedback that they have been hearing has, I think, been very similar to what you're asking. That when we see individuals who have been vaccinated and end up testing positive, whether they're symptomatic or not, it ends up making it very challenging to continue to work to increase vaccine confidence. And I thought that one of the things that was shared by some of our colleagues was really helpful, and it was trying to think about the way that we talk about this. So, for example, in a situation they had shared, there had been a resident who was identified to be mildly symptomatic, but tested and found to test positive. And when they did broader testing and tested other residents, actually throughout the building and staff throughout the building, found just a small number of residents and a small number of staff, and they were all located in this one unit. And so one of the things that we had talked about on this call was that it's a little bit challenging to see it this way, but when they looked at those individuals, the vast majority of them were asymptomatic. Although they were found to be positive and they were vaccinated, that they were not symptomatic. There was no one that ended up needing to go to the hospital or developed serious illness. And it, in this situation specifically, was limited to a certain area of the building. And so one of the things we talked about was defining and pointing out those successes. We know that this vaccine is very effective. It's not 100% effective, but it is highly effective. That effectiveness may be a little bit lower in our elderly adult population, but it is still very effective. But we expect that there may be some individuals who end up testing positive. What we have learned so far is that for most of them, this is going to prevent symptomatic infection and significantly decreases the risk of serious illness. And so while we may see that there are some individuals who do develop a breakthrough infection or develop infection after vaccination, this vaccine is still very effective at reducing symptoms and severe illness. And so this is definitely an area where I think that we need to continue to look at our resources and update resources to help have those conversations, because things are shifting as we have new variants and as we see some of these breakthrough infections. And I do think that we need to be able to address these new questions that are coming up that may be different than what the questions or concerns about vaccination were even a couple of months ago.
Thanks. That's really good explanation. If you don't mind, I think since we're not progressing slides now, if you don't mind, you can turn your camera on now, so folks can interact as well. And so we do have Dr. Chug, who is from a local health department here, and also being part of the organizing group here for this. Kelly, your thing just popped up. So she's asking, does CDC have messaging to directly and concisely address circulating disinformation that COVID-19 vaccines are experimental? Since they have received the EUA, the emergency use authorization, and they're not fully FDA approved yet. If you could, you can speak to that. And I think that's yeah, I mean, people say all kinds of things, as you mentioned, on social media, with some really strange things we heard and see. But does the CDC have something that you can point us towards?
Yes. So I can definitely I can definitely share some of the links. So one of the things that CDC has, although I will say they were in a couple of different places. There were some that were geared specifically toward long-term care. There are some that are more general with the vaccine, but have FAQs. And I believe that this specifically describing the EUA and what that means is one of those. I can definitely take a look. I'm going to note this down so I can try to get back with you all, or try to provide some feedback and resources back to you.
Thank you. And again, it's just one of those things that personally, my family I couldn't join my family for vacation, summer vacation for kids because of this, and I happened to turn the news on. Had a chance last night. I haven't done by myself, and turned the TV on, and there was a cable news channel in a nightly news, and a section on exact this topic, and their medical correspondent, physician. I'm not taking names, but I'm sure people can guess. They did a great job explaining that. I was so impressed. I mean, a lot of time a neurosurgeon becomes a TV correspondent. You kind of, and I think that's hint what I'm talking about. But he did a great job explaining, and I think we just talked about that. A positive culture is not a UTI, right? So, although not quite an example, but yes, you might test positive, but again, are you getting sick? Are you going to a hospital? I think the data showed yesterday by them was that it's almost 100% protective against hospitalization, even with the variant strains. So they were really talking about the variant strains. So, and again, as not part of CDC, not part of the health department, as a practicing physician, since we have some discussion time, I just wanted to weigh in for a lot of people that are listening, is just understanding that we were at 20-25% mortality rate back in last fall. If as a building you were at 10% death in your COVID positive patients, you were lucky. People were seeing upwards to such huge 35-40% death within nursing homes. And so from that to here now, vaccinated people having almost no hospitalization and almost no illness or mild illness, that is the messaging that also needs to be discussed. We talk about outcome, we talk about how people do, and so I just wanted to have that discussion. So a lot of the administrators, the director of nursing, the infection preventionists who are attending this, when they are talking to the resistant staff and families, I think that is a good, so that is a good explanation. And so, testing positive, and then how people do, almost 100% of people that are currently in ICUs are unvaccinated people. And that's a strong, I mean, even if it was 80%, we'd think it was really strong data. But if you're saying 100% of all hospitalization, especially ICUs, are non-vaccinated people, I mean, I think that speaks volumes. And so thank you. I mean, I think the chat is live. So if you get that link, we can share.
Oh, sure. Yeah.
And we do have Kelly from hey, Kelly, from health department. I said I'll do a shout out for Kelly. So I'm going to just read that as well. So there's a question: do you have any idea if COVID vaccine will be offered every year like flu vaccine? And I think that is an active discussion. Is currently,
It's definitely a very active discussion. It is, I was also just having a conversation with some of our colleagues that are directly involved with the ACIP meetings and the conversations that are happening there, as well as some of those who are focused on where we go with vaccinations in long-term care setting. And then, I mean, even more generally outside of that with the general population, the rest of the population. And one of the things that they had shared with us was really what they have been doing at the CDC and at FDA has been trying to understand what kind of data do we need to see to tell us whether or not booster or future doses are needed. And that as of right now, they have, this is the data that we need. This is data that is being gathered that we are looking at. Although there have been, I think, some announcements by others that boosters may be needed, it hasn't been. I think what they have told us, what they've been sharing with us, that CDC has been saying is that this might be something in the future that's needed, but we're not at a place to be able to say if it is for sure or not. We don't have the data to support that it is needed now. And one of the things to continue to emphasize is that, let me step back and just say one of the things that we are closely watching for is what vaccine effectiveness is looking like over time. We are looking to see if this is changing. Can we, and we want to as quickly as possible, if we're seeing this, detect a change in vaccine effectiveness, detect a change in what we're seeing. And if that is the case, that's one of the many things that would help to inform that decision-making process. But right now, what we have continued to see, even months out from receiving vaccination, is that these vaccines continue to be very effective. And that if we want to think about how to best protect some of the most vulnerable individuals in our population, we do need to be thinking about whether or not booster doses or future doses are needed, but we also need to be thinking about protecting those that are around them and are closest to them from potentially being an exposure to the virus. And so that includes vaccinating friends, family, visitors who are coming into long-term care facilities, the staff that are taking care of those individuals, and continuing to talk about that. Oh, I think you're muted still.
Sorry. So yeah, and another question that has come up in the chat is the whole controversy or social media talks about infertility. So is there anything, again, from CDC's perspective that can be used to dispel that and address those concerns?
Yeah, and I would say even outside of just CDC, even though I am with CDC, I would also specifically for this look to information coming from some of our other medical societies, including like the obstetrics and gynecology, pediatrics, and some of the information that is coming from them in terms of their review of the current data and their reporting on and recommendations for this. I would look to them, CDC, FDA, as well, because for additional information and for different types of resources. So CDC, this has definitely been something that CDC has been trying to address, but I share those others just because they are well respected in those fields for putting out their own thoughts and recommendations on these issues. Yeah. And I will also, the one thing I was going to say, and I think this applies to a lot of different areas with the vaccine with confidence strategy, that CDC actually has some teams in place that are even able to do consultation. I will. It's another thing I'm noting down just to make sure. But on those on the vaccine, on the information. Sorry, I'm trying to pull this up so I can see if I can find a link for you all. But through the website, there is information about how you can look into the resources available, but also even talk with or have a consultation with the experts that are truly more experts on this area than I am, but to talk about strategies or to talk about how to specifically work with different populations or based on the concerns that are arising that are more specific to your area, if they, as they may differ, and to try to talk through ways to bring information to to help you with thinking about, different strategies that may work for you, messaging, for example.
Thank you on that, and I do want to read portions of Kelly, who is from Lake County Health Department, and mentioning really how it's really boiling down to that reluctant, culturally hesitant population, and some things that are being done at Lake County Health Department in long-term care facilities where they are addressing the needs of that that culturally hesitant population, having presenters go with health department, doing a quick 15-minute presentation. Definitely folks that are the community identifies, in the whole ambassador program. People listen to people from same communities and same even disciplines. And again, there's a plug for the work we are done, so I'm going to skip over that with the department. But just the key is perseverance and just hanging in there and making those small chips at a time. And we now have done, as vaccine providers, done like all day event with a community fair and vaccinating 3 people, and we come back, it's still, those 3 people would not have been vaccinated.
Agreed.
Yes, we had 2 nurses there all day, but if it so yeah, I mean it every bit matters. Thank you, Kelly, for doing that. And we have a bunch of comments, to her comment. From CDC's perspective, anything about culturally, and minority, staff and residents, and what can be done to address that reluctance and boost the confidence.
So first of all, I was just going to say, Kelly, I was just reading through your comment, and I thank you. I really appreciate you sharing this. And I completely agree with both of you that small numbers are a big win. And the other thing that, Raj, that you had mentioned, that, that what the feedback that we have heard from people is that they do look to and trust their peers and their community. And so even if you're saying, you have nurses there all day and there are only 3 people, but that's still 3 people. And those are 3 people who then may go back to their own communities and their own peers and talk about how they chose to get the vaccination, and people can see through them, and that may be a piece of helping to start to build that trust. And so that is huge. I'm not good at multitasking, so I'm trying to find this link quickly for you, and I'm not finding the right one. So I will find it.
That's really the reason why I read that. Again, when you're speaking, it's kind of hard to look at the chat and answer and multitask. So please pay attention to that. We can make some small talk here, and so that not a problem at all. We have people hanging in tight. Traditionally in conferences and meetings, I'm very, very reluctant to put the thank you slide, even if it's a 30-minute. That's when everybody starts dropping off, and so I would leave it at a different slide, because once that thank you slide is up, although we know the discussion is the most important part, a lot of time attendees start falling off. So I'm just so impressed that we are still increasing in the count here, and that's just again a measure of how important this topic has been, and just information that you have provided. So yeah, we are here, and folks that either know something about the question being discussed, whether it's a booster discussion. And I can ask you that question. I didn't want to kind of just get into the weeds of that, but I think, and you can tell us if you know and if you don't, isn't that Pfizer data being presented to the body that considers it today, or has it already been done? Or I know CDC's announcement or discussion on no current data to support booster need, was that before or after Pfizer's data review on the need for booster?
So I know the last time that they met was the 23rd of June. So they just met within the last couple of weeks. I don't know when they're meeting again. It looks like their next meeting is July 22nd. I'm just looking it up now. It looks like their next meeting is July 22nd. And so whether or not what data they took into account from Pfizer, I'm not certain. I would have to ask some of my colleagues who are even more closely involved with the ACIP meetings. But they will definitely take into account this information. I know what they had told us is that they spent most of their conversation at the last meeting really going over what data they need to be able to consider to make these decisions. And so if they didn't take that into account at the last meeting or weren't able to, I would say that it's pretty safe that they will be looking at and reviewing any available data at their next meetings that are coming up.
Ooh, I was hoping somebody would put this in. I did not want to go there myself because so I am. And thank you, Teresa, for putting that. That is, again, I don't think CDC can comment on that, but that's what we like to do. We bring you here and put you on the spot and tell us what you have to say. And again, it was officially announced, one of the biggest health systems, Trinity, which we have bunch of hospitals here in Illinois and Chicago land area. They have made the decision as vaccination being mandatory for employment, and then phase 1 for leadership and clinical, and then phase 2 for rest. And then this question keeps coming up that it happened for flu shots. They made that mandatory at state levels and all of the stuff around it. And again, that was a long uphill battle for achieving that for most of the states, or however many states that do that. And so health systems have started making those decisions. And I think that was asked whether CDC is going to have, which for flu shots, they still don't, right, on mandatory status, I again, if I'm not mistaken. So anything on that, personal or CDC or however, do you want to weigh in on?
Yeah, sure. So I think one thing that when it comes from CDC specifically, CDC is a public health agency. We're not a regulatory agency. So while we will recommend things, while we will strongly recommend things, we don't regulate or require them, if that makes sense. And for the nursing home setting, now we will work closely with regulatory partners like CMS, for example. We will share data with them. We will share our recommendations, our guidance, even our guidelines if we get to that point, with them, and have conversations with them. But they ultimately, in some areas, will make specific rules or regulations about things happening. At larger levels, the fact that there is still an EUA in place for these vaccines have made it so. I think that it made it challenging in some settings or at some levels to require or mandate that the vaccine is used. But as you're seeing, and honestly, I wouldn't be surprised if we continue to see this in other settings more commonly as we go forward, that it is something that people may start to require. I just reading some of what is written in here, I think we've heard similar things. We've talked to folks who have said it has already been mandated in our facilities. This might be assisted living, this might be long-term care, this might be acute care, healthcare systems, and have said that our numbers are amazing. We've got 95% of staff vaccinated, but we also have heard from smaller assisted living communities saying we've only got a staff of 10 to 15 people, and they will walk to the next place down the road if we tell them they have to do this. How are we supposed to continue caring for our residents if we are truly concerned that people are leaving? So it's really tough. It's a really tough decision. I think ideally, oh, sorry, you're still muted.
I was just
No.
time check. We're
Oh,
we're
yes.
yeah, so we're at time. We'll continue. Wrap your comments up. I just want to say for folks that thank you